To withstand that cold breeze, we use our shoes. This is the major culprit for many foot infections seen during the winter months. To avoid these infections, listen, it's essential to maintain perfect hygiene, like changing your socks every day. If you sweat, use a lot of spray, some powder. These are just some of the concerns many of us face with the cold days ahead. And David says you better get ready for this weekend. Our favorite foot doctor is back on the show, Ira Kraus, with those issues. And I hate to bring this up, folks, we got to talk bunions. Ira, how you doing, buddy?
I'm doing good, Jed. How are you?
My feet are feeling good, but this is important stuff. I mean, we don't think about the impact that our shoes have in the winter months.
Every single day. I mean, I see patients all the time, and you know what happens is people are wearing 2 and 3 pairs of socks. Their feet are sweating even more. Not only are they sweating, which causes infection, but because they're wearing multiple socks, their shoes are tight, they're getting blisters. So everything is happening because they're trying to protect against the cold weather. And so we see a lot of problems.
Nothing more painful than cracked feet. I mean, your hands are cracked. That hurts, buddy. What do you recommend?
You know, there's some good over-the-counter lotions. I'm going to tell you what I tell my patients. I don't care whether you get something in the pharmacy. I don't care whether you get one of our over-the-counter products, or I don't care if I write you a prescription. If you're going to spend money on a product, don't leave it sitting on the shelf. You have to use it. Buying something to use on those cracked feet or those painful feet and not using it doesn't do you any good.
All right, look, can you put that stuff on your feet and then put a sock on it and go to bed? Can that serve as like an insulator?
You know, it's interesting. There's a couple of different lotions that actually require you to let it have some time to absorb, but there are also lotions, and I like to call it putting it under occlusion. You're going to laugh when I tell you this. Put it on your feet at night, wrap your feet in some saran wrap, and then put a pair of socks on. That will help make the occlusion so the moisture, instead of dissipating into the air, will bounce off the saran wrap and get reabsorbed in your feet, so you'll be rehydrating your feet as you're sleeping.
You work out in the gym. I mean, if you don't wear sandals, can you pick up?
Of course, you can get bacterial or fungal infections.
Even if it's a hot shower, I mean, can it still stay
Yes, on? Yeah, you can get bacteria, you can get fungus, they can come onto your feet. I recommend obviously wearing flip-flops, not going barefoot in the gyms. I recommend if you do go barefoot in the gym and before you're going to put on your shoes, spray some antifungal powder into your shoes. So if you did pick up anything, maybe you can counteract that.
So many people, marathons these days, whether it's a half marathon, even if they're training for a 5K, man, you get those black toes. What is going on here? Is that poor shoes?
You know, that's something that we can't control. Sometimes the runners particularly, they piston in their shoes. And a lot of times when we see the black toes, the shoe may have been a little bit too long and they were pistoning too much. But sometimes we do see it, even if it's the correct shoe size, they get
what do you mean,
repetitive.
Pistoning?
Well, when you're hitting in your shoe, so you're like pistoning. So every time you're landing and you're planting, so it's causing the foot to drive forward into the shoe. So sometimes we see patients, I see people who are runners who have chronic, what I would call dystrophic nails, or nails that have been traumatized but are not yet necessarily fungal, they're not infected, they've just been damaged because of the level of activity and the amount of pistoning that's happening in the shoe.
All right, let me ask you this question. We don't see those horrible commercials anymore with those cartoon characters are opening the nail up.
Right.
They're talking about the fungal infection.
That was the Lamisil. That was Digger the Dermatophyte.
I mean, is it effective? Because I wake up in a cold sweat thinking about that commercial, but is there anything, do you still have to take a pill to get rid of this?
You know, I think
liver damage as well?
I think that the pill is a good product. I will tell you that I monitor my blood work on my patients. I've been using it safely for 23 years and have probably had 5 patients that had elevated liver enzymes. All are reversible once the medication.
It's still out on the market. There's
it's
not
still
a generic,
out on the market.
It's expensive.
No, there's generic. It's actually $4 a month now.
Wow.
It used to be $300 a month. Now it's $4 a month at Walmart. It is generic at $4 a month. I definitely recommend if you have fungus, you should treat it in 3 ways. Systemically with the medication, if your body can tolerate it, environmentally by disinfecting your shoes, and topically by using a product on your nails as well, so you're hitting it from all directions.
All right, speaking of hitting it in all directions, we got to talk about bunions real quickly. Man, that hurts.
They're painful.
Side of the toe?
Side of the big toe, it looks like a knot. People call it a bump or a sore or a knot. They're very, very painful.
So what do you do?
You know, conservatively, I tell patients if they can wear alternative shoes and wear pads and feel comfortable, that's fine. I tell patients if they've gotten to the point where the pain is becoming chronic, like a 6 out of 10 or more on a regular basis, you probably need to consider some type of professional treatment. We sometimes start with injections to reduce the inflammation, but ultimately, if it's really causing a lot of pain, the only way to correct it is to surgically repair the bone.
First of all, you need to explain what is a bunion.
A bunion is when you have a protrusion. Can I use my hand?
Absolutely.
So you have your metatarsals. So the first metatarsal, but we'll use this finger, separates away from the rest of the foot, and then the toe deviates over. So you can imagine that it forms like a V. So the big toe is turning out, and the long bone turns in.
So they're rubbing against each other?
No, they're pushing away. They're counteracting. So they're making like a V.
So why the pain then?
Because it's a large bump on the side of the toe hitting the shoe. It gets inflamed. The soft tissue around the capsule gets irritated. So we can get inflammation and irritation causing bursitis. So those are the reasons people can get also a big area. People get gout in that big toe joint. That also is where the bunion is.
We are in the gout belt, buddy.
Yeah.
That's painful.
It's very painful. But there are conservative treatments. But if you let it go too long and you get arthritis in the joint, these are, I will tell you that arthritic joints, something called hallux limitus, where you lose the motion of the joint, is the injury that ended some of the top professional pro football linebackers in history, because they get what's called turf toe, which is not exactly a bunion, but it happens when you get in the same big toe joint as the bunion, where you get arthritis in that joint.
Man, you talk feet, buddy. Nobody talks it better. Ira Kraus. It's Advanced Foot Care Centers. There it is, 698-1966 Advanced Foot Care Centers. They're all over the place.com. Ira Kraus, you make feet fun, buddy. We love having you on the show. We're back after this. We're going up the body to your eyes right after this.